Welcome back to the Progressive Podiatry Project. As always, I'm your host, Talysha, and today we're joined by brilliant physio, amazing human, and bone stress buddy, Beau Walker-Tyrrell. So, Beau, welcome.
How we doing?
Early but good. So there's coffee involved today.
Indeed. Cheers.
So a lot of you may have noticed the last few months, well, those of you that follow me on Instagram and or LinkedIn, is sort of towards the end of last year, because I was in the throes of putting together some new courses, more content for the subscriptions that we have. I just decided that I would start to share a lot of like TLDR, basically, too long didn't read reviews of or summaries of literature. And there's been quite a lot of engagement and interest in that. So now I do have the monthly research roundup through the Progressive Podiatry Project, where it's a monthly summary and articles sent to your inbox directly. Basically, it's a newsletter that keeps you up to date on current MSK lower limb literature. So if you're interested in that, progressivepodiatryproject.com/research roundup. Now, how we got to having this episode and Beau joining us is there was a paper that I shared not long ago that was on, it was a systematic review on the efficacy of strengthening for reducing the risk or preventing running related injuries. And as we know, the literature is quite all over the shop as far as the efficacy. So I wanted to bring Beau on board because he and I had some great discussions about this paper. So today we're going to be talking about strength training, running related injuries, and kind of unpacking where the literature sits, sort of the strengths, the weaknesses, and kind of the clinical utility on this. So let's get into it. Hi there, I'm Talysha, podiatrist, clinical educator, and injury rehabilitator, and this is the Progressive Podiatry Project. We're here to share knowledge, insights, and information to evolve your clinical practice, and most importantly, help you help your clients.
Yeah, 100%. I'd just like to give a quick shout out to the roundup you do as well. Some of the papers you're putting out are like a week or two old, and they're like really, really gems. I'm looking at some of the stuff you sent out, and it's like, wow, all of these are so useful and so new and like really high quality papers. You're not just sending out like random little case studies on random little things. It's like, oh, this is like an actual probably landmark paper for 10 years from now. Like it's so good.
Awesome, thank you. Yeah, the papers that go into the roundup are like, I'll trawl through probably about 60 odd a week, and then it's only a select few that I go through, because as we know, there are some that are sort of a bit rubbish, not impactful, but then there is, and that's what we're seeing, and it's getting harder and harder to keep up with, is there's just more and more and more quality research coming out. So even me keeping up with trying to help people keep up, it's a bit mind-boggling, but it is fun. I do enjoy it.
I read a lot of papers and I search a lot, and the stuff you put out is really good. I love
Also,
it.
I like you, and I do appreciate that from you, because I know that you are so up with contemporary evidence. Like, those of you that don't follow Beau, I would highly recommend jumping over onto Instagram. So we've got Beau the Physio, which is Beau Science 101, and also Stress Fracture Physio,
Yeah.
which that Beau has a very special interest, and we have we're bone stress buddies, because funnily enough, we share bone stress injury history that is very similar. Yeah, so you are probably one of the most insightful up-and-coming physios that I've come across, which is why I personally fangirl you, and I do appreciate any time that you give us over here at P3.
Oh, awesome. Thank you.
So now that we've pumped up each other's tires sort of sufficiently, I'm going to bounce over to you initially for just your thoughts on, well, actually, you can introduce the paper that we were talking about, that we're mainly referencing today, because I've already done a shitload of talking, so I would like to bounce over to you. So if you can give us a little bit of a rundown on the paper and just the overview of what you're wanting to discuss with us today.
Yeah. So the paper we're discussing is titled "Do Exercise-Based Programs Reduce Injury in Endurance Runners?" And it's a systematic review and meta-analysis by Han Wu and a few, I hope it's Han Wu, it might be Han Wu, apologies. Han Wu and some colleagues. It came out like January, 4 weeks ago, 3 weeks ago. So good job to you for finding that paper. But it's actually quite a nice study design, and it's collected up a bunch of papers on participants who are primarily runners that do endurance sports, and they've got about 9 okay studies in it. And we're looking to dive into each of those studies a tiny bit and just kind of work out what to do with the findings that they've presented, because this is a pretty difficult area to study. And it's also a really, really limited area of research. So having a meta-analysis, I was actually shocked there was enough papers. And it's going to be pretty cool to just chat about what they did, what we think about it, again, like the strengths and limitations. I'd kind of like to start, though, just talking about what the basis of strength training is for injury prevention. And not even just strength training, just S&C in general, because we do find that in broader populations, strength training and resistance training specifically has a really big impact on reducing injuries. So when you look at broader systematic reviews, they found that strength interventions can prevent up to 35% of acute injuries and up to 50% of overuse injuries. And that was across field sports and some running and military populations. But we see that on much broader scales that strength training works really, really well. Strength itself is a predictor of injury from a large systematic review done in 2017 by Delamotte, Motte. Sorry, I'm probably butchering that one as well. But they had about 40,000 people included in their sample size. And just having like a stronger knee and a stronger ankle was basically protective against injury across a very, very broad sample. Given that running is a very repetitive, monotonous task, we should start to see that strength training should give some kind of resilience that relates strongly to preventing injury, because we're only really doing one task and we just need to kind of prepare ourselves for that one task. That may vary in slight ways, but is largely very monotonous. So it's very interesting when we look into the running research, and nothing really so far has panned out in terms of the literature. And it's even more backwards as well, because I think sometimes it's about the questions that we're asking. If we've got runners and they all get a very small subset of injuries, ITBs, Achilles, patellofemoral pain, some certain foot pains, and like very occasionally some hip and back pain as well, we probably should be asking some more specific questions, because when we look into other areas, we've got research specifically on preventing adductor injuries, hamstring injuries, anterior knee pain, ACLs across ranges and ranges of sports. And we go really deep into what interventions might help prevent those injuries. But in runners, we don't really have any kind of specific framework for what we want to do. And I think probably starting to come up with some more specific things to focus on certain areas, knees, ankles, hips, to start to propose better questions is, I'm spoiling kind of where we're going with this, is really what we need, because it's just not there. If we talk about like a hamstring injury in a sprinter, the basis of the rehab is firstly exposing them to some sprinting so that they're more resilient and used to that really high force, but also just doing some hard eccentric loading so that they get stronger muscles, longer muscles that are a bit more resilient to the load you put them in. Those principles should apply to most of the areas of running. We should just be able to give people stronger muscles and tendons and then have less muscle and tendon issues. Because having slightly more resilient tissues should, in theory, make you tolerate the forces that you're going to put into them.
Which is true. So I do agree that the theory behind that, and you introduced that so much better than I could, so I appreciate that. Glad I handed it over to you. It's quite interesting. And I think that point that you mentioned as far as the questions that are being asked in research and the sort of specifics relating to the questions and the interventions and certain injuries, that's kind of, again, where we're going to be heading with this chat. And I think that's where there's sort of this inherent problem and the criticism that comes out as far as, well, strength training doesn't work for runners because it is so broad. So different types of running require different types of tolerance, and then also different interventions they trigger different adaptations. So even just the difference in external load and then the tempo and everything like that, it does influence things. And where I think a problem lies is it's so varied. So everyone's initial starting capacity is going to be different. And then everyone's response to certain interventions, that's going to be different. So when there's very specific nuanced needs of individuals, that's where it can become quite difficult for this sort of general application of exercise therapies to potentially improve the risk, but then reduce the risk, I should say. But then I do think that part of it, I don't know about you, but this is what I found with this paper. So we'll start diving into this paper, was even some of the selection of the exercises to reduce risk. Sometimes it's almost like a failure to consider the required or desired capacity. So within this systematic review and meta-analysis, there were 9 studies included that explored a vast array of exercise modalities. So we had jumping and plyometric exercises, multi-joint and single joint strength exercises, exercises that focused on the core and trunk musculature, so core strengthening, balance and proprioceptive exercises, stretching or mobility exercises, and sprint and running agility drills, basically. So where I kind of want this to go, actually, because you've, like I said, done a little bit more of a deep dive into a few of these papers, but I'll just sort of summarize the findings from this paper, the systematic review, essentially quoting it. So when data were pulled together, exercise-based injury prevention programs provided no significant positive effect on either injury risk or injury rate. And then what they did find, which is kind of contrary to some other studies, like the sprint study that was, it's a few years old now, I can't remember what year, 2021, 20, anyway, somewhere around there. So what they found with this study, or this systematic review, were those that actually had more supervision and that sort of engagement with the exercise interventions had slightly more positive effects, but overall it wasn't really statistically significant. Whereas in the sprint study from a few years ago, they actually found that those participants, which was like 4,000 odd runners, I think, those that adhered more strictly to the interventions, none of which included strength training, but it was all the other things that are considered risk factors for running related injuries, those that adhered more and followed the sprint intervention more, they actually had a slightly higher ratio of injuries compared to those that weren't following it as much. So, Beau, with this systematic review, basically, because we will be talking a little bit more about the different populations and where the relative risk of running injuries come from and sort of where things fits in. So we do know it works well for other populations. So with those, are there any sort of specific mechanisms that you feel from strength training interventions, so any specific mechanisms that may contribute to that sort of protective element that we're thinking may exist?
Well, I think there's a number when we talk about different sports, and I think there's probably more facets in other areas that we can lean into, and it might be why some of the multimodal interventions that they used work really, really well. Like doing balance exercises, different kind of coordination and control exercises in sports like soccer and rugby and netball are going to work really well because they do lots of varied activities and they have to respond to a chaotic environment. So I think there's a element where you just want to be able to control your environment better, control yourself in your environment better. But I think in those populations, when we're looking more at the overuse injuries that are primarily due to repeated running and jumping, the main mechanisms are going to be for preventing overuse injuries are just going to be increasing either their efficiency with the movement or the use of their own musculature, which is, I guess, still neuromuscular rehab. If you can use your muscles slightly more efficiently, you're going to impart less load during repetitive activities. And then if we look at some other mechanisms, it's literally just making the tissue stronger, which is going to take 6 to 8 to 12 weeks. for your muscles, and then quite a bit longer for your tendons and your bones. So in terms of timescale, it varies, but in terms of the things that we're looking for, it's really probably just slightly more resilient tissues and being a bit more efficient. But if I'm honest, I actually think you understand the mechanisms better than I do, so I'd probably hand it back to you.
Well, yeah, so there's sort of tissue-specific mechanisms for different interventions, but they can be achieved via a number of different elements. So when we're talking about these sort of specific mechanisms, so if we think of, I'm not going to give everyone too much of a sort of pathophysiology and functional anatomy deep dive, but just for an example, so when we've got tendons, so we talk quite often about the ratio of stiffness and compliance, and that sort of sits in relation to Young's modulus of elasticity. So typically when we have tissues that are more stiff, and in this example we're talking about, let's say, the Achilles tendon. So tissues that are more stiff, they tend to deform less under an applied force. And then tissues that are more compliant, there's more deformation that occurs with a lower degree of force. So when tendons, we want, especially the Achilles tendon, to store and release elastic strain energy. So typically what we want is a stiffer tissue because it will store and release more energy. When we have, they call it hysteresis. So that's essentially energy dissipation that's sort of lost as heat. And that's where how much energy is lost per cyclic load. The greater the degree of hysteresis that occurs, typically there's more of this energy dissipation or being lost to heat. So as what energy is going in, there isn't as much coming out. Now, the more sort of pathological a tendon, so let's say we've got someone with mid-portion Achilles tendinopathy, and we do see some of those changes. So the increase in proteoglycan content, the increase in myxoid ground substance, essentially that contributes to increased fiber slippage, which means that it is a little bit more compliant of a tissue, and there is more of that energy being lost as heat. So what we want to do for those people is increase the stiffness, and that's where it comes into play as far as specific exercise interventions can assist with that, plus also monitoring load, because we do need that adaptation to occur. So we need to apply load so it can create the pathway, so via mechanotransduction, the cell signaling, to begin the cellular process of increasing the stiffness, but we need time after that application of load for that to occur. So with increasing stiffness, we have what's called collagen crosslinks. So they are essentially, the more crosslinks we have, typically the stiffer the tissue, because instead of it just being the fibers organized longitudinally, then we sort of have these little bars between them that kind of connect them. So the tendon itself acts more like one whole unit instead of that fiber slippage. So the stiffer it is, typically the more crosslinks are involved, which means less energy lost via hysteresis. So the good thing is, when it comes to tissue adaptations, stretching can increase collagen crosslinks. Isotonic exercises, concentric and eccentric, can increase collagen crosslinks, as can plyometric exercises. So across the entire spectrum of exercises that we may prescribe, we can increase the stiffness of a tissue. Now, where the adaptation will either occur or not occur is when the dosage, so dosage involves the selection of the exercise plus the actual prescribed dosage. So let's say we're prescribing a stretch exercise at 15 seconds 6 times a day, or it might be a eccentric focused calf raise. That might be 4 sets of 15 repetitions with a tempo of sort of 4 seconds eccentric, 1 second concentric. Essentially, we're going to get alterations and stimulus that may increase the collagen crosslinks, but it needs to align with the person's capacity. So if we're applying a dosage that isn't sufficient to where the person's capacity is at, we're going to be underdosing, so you're not going to get that positive therapeutic effect. Whereas if we go too hard, so we're prescribing something that is in excess of the person's tissue tolerating capacity, then we're contributing to a pathological process. So it's about aligning where their capacity is to the dosage that we're prescribing. So that's where I think there's already a little bit of a problem that exists because everyone's dosage requirements will vary, even if it's for a specific activity. So like, depending on what gender, that influences it. So males typically are a little bit stiffer in their musculotendinous unit complexes than females until menopause kicks in, then we kind of even out a little bit. But so males tend to be a little bit stiffer. People's chronic or long-term load exposure history, that will change relative to how many crosslinks may be involved. And it's not just crosslinks, it's other tissues that come into play or cellular processes that come into play. But that's just one example. So I'm going off track. I hope you can reel me back in. So I deep dove into the physiological elements. So there's that. Quickly touching on another one where we've got a protective element of strength training is our old man calf injury. So where there's a rapid eccentric load, that the applied load exceeds the eccentric strength tolerance of the muscle tendon unit complex, then we end up with things tearing. So that's where being prescriptive with what we're prescribing as far as an exercise intervention goes, it can have those protective elements, but in a prospective, so we're predicting how effective the intervention will be, I still think there's a lot of difficulty in being able to apply a dosage for injury risk reduction, because until something goes wrong, we often don't know at a tissue and cellular level what the deficits are. Does that kind of make sense?
Yeah, it's like we need it to start leaking. We need the oil rig to start leaking for us to fix the patch, if that makes sense, to work out where the problem was.
Yeah, and that's where I think it goes. So are you someone who believes that, and there's no right or wrong answer here, it's just conversation, right? So are there any elements that you feel that, for, let's say we're just talking about endurance running in this realm, that strength training may be able to reduce the risk of injury, sort of at that kind of global scale?
I actually think that endurance running is one of the best sports for that to be the case, if that makes sense, because it is such a repetitive task. You really can probably just get someone to have more resilient tissues in the key areas that they're being loaded in, and that they get the most common overuse injuries in. But I think this is a situation where we need to be the most specific compared to other areas where it's like, there's so many ways for us to improve someone's tolerance to soccer. Like, just get them better at soccer, they'll tolerate it better. Get them a little bit fitter, they'll tolerate it better. Get them a little bit more coordinated in landing, they'll tolerate it better. Running, it's just how well, like, sure, we can talk about a bit of technique. We can make sure they're recovering well and managing their load well. But I think really diving into making sure that we can get their muscles and tendons stronger and their bones as well is like a pretty surefire way, in my opinion, for reducing any more overuse injuries that runners get. I think we could do some balance stuff for reducing ankle sprains, especially in trail runners. And there is some research in the papers that we're going to go through that suggests that's true. And I think there are some specific interventions throughout this paper that suggest that we can do specific interventions for specific injury risk reduction, especially on a broader scale, including military populations. So I feel like I'm unbelievably biased and well-rooted into this opinion. So I will preface everything that I say from now on with that, because in my mind, whenever I go through thinking about this, I just can't come up with reasons why strength training shouldn't work in this population. To me, it's just, it works so well for performance. I just feel like those studies that they've done are better. There's more of them. And I just want to see us do some really good studies on improving injury risk reduction in these runners, because to me, I really can't convince myself that it's not going to be effective unless we're overdoing it, either by giving them far too much load, which is actually hard to do. It's hard to overtrain with strength training. It's easy with plyometrics, but it's hard with strength training. And even plyometrics, it's pretty difficult. I shouldn't say it's easy, it's pretty difficult. And then I think underdoing it, that you're just not going to get anything out of it. So I like, those are probably the caveats to when it works and when it doesn't, and that's why it's important that we we start them at a level that makes sense based off what they tell us, and then we progress from there. I think some of these exercises should just be dosed based off their rate of perceived exertion or how many reps they have left. Like everyone should be going between 3 to 2 reps left in reserve during these exercises. If it's too easy, there should just be natural progressions within the exercises themselves. That's just an easy way to self-dose the patients, or, what's the word? What's the word where it just auto-adapts? Auto-regulate the patients themselves. Like I feel like that's such a simple way to make it very globally effective. And then I think probably the other thing that's going to factor in is just how long they do it and how often they do it.
Yes.
That's if we're going to skip ahead to the main problem with this paper, because the paper itself, the actual systematic review, is really good. They've gone through and they've made a really intelligent selection criteria. They've made sure to contact all the authors and get all of the relevant data. They've gone through and they've basically picked all of the best papers, ones that I've missed when I've done previous reviews on this, trying to find all of the strength research. And they've gone and collected some like really, really like high quality evidence, and in their analysis of the evidence, they do suggest that the findings are of moderate quality or of high quality, even though some of the papers are at high risk. They've just done a really good job at selecting studies and structuring this actual meta-analysis and systematic review. But when we look at the actual studies, the biggest hole, and something that you mentioned, was that when runners aren't going to do the training, they're probably not going to see the benefits of the training. If we're talking about the question we're asking, okay, if do people get reduced injury risks when they do strength training, particularly in runners? And if they're not going to do the strength training, then we're not answering that question, like essentially. This paper to me is almost asking, will runners do strength training? And the answer is people know about strength training, runners know about strength training, but they don't often actually do it when you give it to them. The overall adherence across this ranged from, I think, like 30 or 20% through to about 85%, which just isn't really good enough, if I'm honest. Like if only 30% of your participants are doing, if only 30% of your participants are doing even, 3 out of the 4 exercises 3 out of the 4 sessions that you give them, they're probably not going to see an adaptation as well as the people who do it, 4 times religiously all the time. So I think that's probably a really big call out, because this study, when they did actually select for the people that were supervised, which basically just meant they had higher adherence, closer to around that 85%, those studies where they had that higher adherence, they found it was statistically significant in reducing injury risk by about 33%. And that was just across, I believe, 3 studies that actually had quite small sample sizes, but they were also the 3 best conducted studies in terms of strength and conditioning. So to talk about the specific interventions that were used across these tests, some of them were primarily just body weight strengthening exercises, or they were just balance exercises. And realistically, that's not going to be massively effective because the load going through your body when you're running is really, really high. If we talk about the specifics of load through the calf alone, it's anywhere from 6 to 8 through your soleus, which is just one of the calf muscles. And then there's quite high loads at slow speeds through the gastroc muscle, as well as the quad and hip, but relatively low compared to high speed running. And if we're trying to get adaptations in those tissues, if you're running at all, the tissues are going to be, fairly resilient. And if you're just giving someone a bodyweight squat, it's likely that that's not going to be sufficient to draw out big adaptations in terms of muscle or tendon quality. Diving deeper into,
I just wanted to touch on that. So the Baxter paper from, I think it was 2020 or 2021, where they published a really good, and we've seen it on social media. I've shared it on social media. So many people have, where it's got the exercises that incrementally load the Achilles tendon. And I speak to it quite often when we're talking about rehabilitation, because a lot of people will sort of stop their tissue dosage and their rehab dosage at, say, a single leg calf raise. And when they're actually looking at it, the single leg calf raise is only applying maybe a third to a half. I'm just going off memory. It is early in the morning, but significantly less load through the Achilles tendon than running. So if we're stopping someone there, so single leg calf raise, to try and get back to running, then we're leaving them with this capacity gap, which does sort of increase their risk of developing another injury later on down the track once they're back to running. So I think that's one thing that's really important to consider with your point, is the fact that, yeah, if we're prescribing an intervention, whether or not it's for injury risk reduction or even in a rehabilitation sense, if we're applying or prescribing something that is not sufficiently loading a tissue to increase their adaptation, it's not going to have much of an effect. It's just going to be an exercise in futility, really.
Yeah, and I mean, we've actually had studies come out about, not, they don't include running for the forces through your hip musculature, that I'm aware of, but like these exercises need to be pretty hard to put significant strain through the hip muscles. And then we also have studies coming out now on, like a really recent study came out, I don't remember the name, I'm sorry, but through the patella tendon and the patellofemoral joint based on how much load we're putting in the exercises. So those do compare to running, and you need to put a lot of force and do some quite difficult exercises to even replicate the simple demands of running. And if we're trying to get big adaptations that are going to prevent overuse, injuries in runners, we actually probably need to go beyond just, matching the demands. We need to be giving you something that's, super maximal or super like physiological so that you can get some more adaptations. I'm not saying go, try and lift a bus, but like it needs to be difficult.
Yeah, and it all dials back to dosage. Now, where I did want to ask you a question. So when we're talking about strength training for reducing the risk of injuries, do you feel that there is a difference? Because there are some, I can't think of the names of the papers specifically off the top of my head. I just know that they exist. I'm not a Rain Man in that sense. Do you feel that the utility of strength training for reducing running injury risk differs between novice and inexperienced runners compared to more elite or experienced?
Oh yeah, 100%. I feel like in novice runners, the threshold is probably a lot lower and they'll get a lot more out of the training and it can be a lot simpler. Like you don't have to do anything crazy, just doing a few probably weighted calf raises, a few quad-based exercises and a few hip-based exercises are going to go so far in that population because you're actually just going to be like accelerating the adaptation to the sport. And then when they're going and running, hope if it doesn't allow them to run too much, like if they don't go and run heaps, then I think their tissues are going to be more adapted for the running stimulus. Versus in our elite runners, we probably have to be doing some more intense things to firstly mitigate any running injuries that they already have. Like we have to be really on top of it. Like most runners are going to have had injuries throughout their career. I think the statistic is like 80% over the first few years. So most runners are going to have had injuries, and we need to reduce any kind of issues that are secondary to that in our elite runners because the biggest risk for injury is a previous injury, and we need to reduce any things that are going to increase the risk there. And then probably the things we need to be doing are going to be, higher load isometrics for chasing some tissue adaptation. We need to be chasing some more intense, probably strength exercises that are isotonic, eccentric, concentric, particularly the eccentric for improving the muscle quality. And then we probably need to be doing some plyometrics to improve the general muscle, quasi-muscle stiffness, as well as trying to chase some like probably bone health if they're doing really, really high mileage. So I would be saying you need to be really, really specific to the really elite runners in terms of pushing the envelope and managing any risks that they have already. And then in the general population that are more novice runners, yes, they're going to go run way too much. And yes, they're just at a high risk because they're not used to the sport. And that actually is probably a good thing because you can just prepare them better for that kind of simple thing that's new to them. And you don't have to be ultra specific. Where do you
Yes.
land on that?
And well, because when we look at when they talk about the risk of running related injuries, it's often reported as the sort of risk per 1,000 hours of running. And the injury risk, it does vary quite greatly between novice and inexperienced runners to our more experienced / elite runners. So I can't remember the stats off the top of my head, but it's somewhere in the realm of like 3 to 4 times more likely. So novice runners have an increased risk, significantly more than those that are more experienced. And training errors will often come into play, I feel, with that. But even just that, like you were saying, that initial sort of baseline strength profile or neuromuscular strength profile that a novice runner can glean from doing some strength training, it might help with that physical preparation for running for a couple of reasons. So one, like I just mentioned, there's often training errors that will contribute to it. So someone who has gone, okay, all of a sudden I'm going to enter a 10K with my partner or half marathon, whatever it is. Novice runners, they tend to go out a little bit hard because we do have that sort of little window where it's sort of in the first kind of 4 to 6 weeks where we can, especially if you're a novice, you can kind of increase your loads quite significantly before you kind of plateau to your capacity. And then we do know that with bone stress injuries and even some of our tendinopathy presentations, it can take a little while for that sort of damage to sort of accumulate within the tissues before we become symptomatic. So one of the biggest errors is we might have a runner that Monday they run and go, oh, that felt great. So I'm going to do the same again on Tuesday and Wednesday and Thursday and Friday. And then 4 weeks later, bang, they've got an injury. So I think twofold, there's potential mechanisms essentially where strength training might be beneficial for those runners. One is just introducing a different stimulus for tissue adaptation. So like I was saying, we do in when I was talking about crosslinks and other neuromuscular stiffness adaptations that we can achieve, which we can get from running, but we can also get from various iterations of strength training. So if we've got someone that is a novice runner and they're starting to run, probably one of the mechanisms that is going to be helping is even just breaking up their training load. So they're still getting some load stimulus, just in a different way. So instead of it being the continual cyclic loading that comes from running, it may just be some actual tissue specific eccentric loading to the gastrocoileus complex. So it's probably going to build their baseline capacity that little bit quicker, but then it's also injecting a little bit of cross training essentially into it. So it's allowing the tissues to adapt from the previous running exposure. So I think in novice runners, if we're prospectively or trying to reduce the risk of them developing an injury if they haven't had one before, that's where I feel it probably has some utility, mixing up training loads, building baseline capacity. But then if we look at more experienced runners, so there's been a few studies that they've done resistance training for more experienced, like elite and experienced runners, and there wasn't much of a difference at all between the risk of developing a running related injury. And this is my opinion, I feel that in novice populations, it probably can have an effect. But then once we hit more elite, it doesn't seem like there's as much of an effect because a few reasons. Once we've got someone that's a little bit more elite and experienced, they tend to be running quite like their weekly accumulation of load essentially is often running quite high near their capacity unless they're doing a taper for an event. So with that, it's a very narrow window where we can inject more training for tissue stimulus to have a positive response without tipping them over the edge into overloading, because we do need some recovery. Now this is where dosage comes into play, but that's where it leans on the chronic interference hypothesis, where a lot of people think strength training interferes with endurance performance, endurance training interferes with strength performance, but the dosage can come into play. So if we're prescribing, say, 10 or 12 repetitions of an exercise that tends to be that little bit more metabolically demanding, that's where the fatigue can kick in, can affect endurance performance. However, if we're prescribing higher load. So let's just say it's a calf raise at, I don't know, an extra seated calf raise plus 80 kilos. That's quite high. But anyway, doing 3 repetitions of that, that's more neurologically demanding. So we can get some of those adaptations, but it's not metabolically demanding as much. So they can recover quicker and start to train more. So that's where balancing that load between experienced and novice runners, I feel it differs. I don't know if that makes sense.
Yeah, it does. I will say, I mentioned before, there is a narrative review on strength training and like just exercise for running for performance and for injury reduction. I can grab the name actually. It's pretty recent, but they found it was actually quite hard to significantly overtrain with like strength training and resistance training across like a general population. I think it is going to be different when we talk about specifically these, more elite runners. And I think I actually agree like entirely. If they're already up at their capacity and you're adding load, you have to be really, really careful. And that's where it's like it's adding the tiniest thing at a time, or waiting and talking with their running coach, talking about off season, what you can implementing it during the off season, and then like holding it at a very low level throughout the year to maintain adaptations or push them up very, very slowly. So it's all about timing, it's all about dosage, it's all about making sure that you're not tipping them over. But I think I do think that there is just an inherent risk when you're running heaps more. Because if you go run some different routes and it's more hilly, if you go run or you have some bad sleep, if you have, some small changes across, the hundreds of Ks that you're doing, it really, really compounds. And I think that even though most of the runners who get to that point are kind of genetically and also just weeded out, because the people that aren't built to, I'm making it sound so restrictive, but there are just some people who are like built to run, and they're going to get through because they're not going to get hurt. That's just like a kind of a selection bias. And then also they're going to get through because they're just more resilient, either genetically or from their previous history. And those people are going to get through just kind of off like just the seat of their pants. They're just going to get pulled through. So there's a component where some of these people are just like naturally lower risk for an injury or naturally going to perform better. But in saying that, I do think there is still just this inherent risk with the training that they're doing and the variables that can change, that we need to be doing some different things that can give them some different adaptations and prepare for differences in the training. It's just how you do it is probably really, really hard. And it's probably going to take a lot more work and a lot more fine tuning to get a good outcome and being really, really specific than in a general runner where like we can do kind of not anything, as we see with this paper, like they chuck anything at it, it doesn't work. You need to be specific in novice runners, at least to like some general tissue that you need to chain and a little bit more intensely. But in like a elite runner, we probably need to be very, very specific in terms of the dosage, the timing, how much we're doing and how much intensity we're giving them. And as well as the modalities, as I mentioned before.
Yeah.
So I kind of disagree with you very slightly, but I can see entirely where you're coming from. And I agree with like everything you said. I'm just kind of looking at it from a tiny different angle.
Yeah, and that's why I wanted to chat to you about this, because I know there are some differences just from when we were speaking about it. And I just wanted to point out, so when we're talking about the chronic interference hypothesis, it's more so the injection of more metabolically demanding strength training, it's more the impact on performance. So not so much that compounding injury risk, if that makes sense. So if you've got someone that they're already running quite significant Ks per week, and then they've got, say, a speed session or a threshold session on a Thursday, and on the Wednesday, we've got them doing sort of 4 sets of 12 repetitions of a squat. Because of that fatigue factor, they're likely going to run slower during that threshold session. That doesn't necessarily increase their risk of being injured during that session. They're not going to be running at that speed because they're still in that recovery mode from that exercise. Whereas if they were squatting at, I don't know, they were doing, say, 80 kilos, 3 sets of 3 repetitions, they're still getting some tissue loading occurring, but it's likely not going to fatigue them and impact their next day performance as much as the more metabolic stuff. So that was just one thing I wanted to clarify there
Oh yeah,
in
yeah.
regards to that.
I agree 100%. Like going and doing really, really heavy, repeated eccentric exercises, like doing higher reps of that is going to cook anyone in any setting, especially in runners who aren't used to it. So definitely like need to be doing lower reps, higher intensity, chasing more neural adaptation, and be like gradually introducing even eccentric components that are like really heavy and pushing the envelope as well, because that's definitely more metabolically demanding. Is that like, I think we're saying the same thing.
Yes,
Yeah.
we are.
Okay.
And I think that's one thing before we jump into the paper, which we're getting to in a
I know. Wow,
second.
we've gotten derailed a few times here, haven't we? It's good.
Oh, it's the rabbit hole. Yeah, it happens all the time. With, I think that point that we were just talking about, that's one thing that clinicians, when they're returning runners to running from being injured and they've been doing some strength training, that's probably one thing that they need to pay attention to, because that's probably one of the things that trips them up. So if they've been doing 5 days a week, more metabolically demanding dosages of strength training, and then they're injecting some running back into the equation and they're not backing off that dosage, that's where runners can quite often feel that like, oh, getting back to running is really, really hard because the clinician isn't sort of adjusting the dosage of the strength relative to the new injection of the running. So now that we've covered that off, let's dive into the paper, because yes, heads up, everyone, this is an extended episode.
Yes. So I think we've kind of touched on the key points around the study design. I think they did do a good job of like actually structuring the meta-analysis itself. It's just, am I allowed to swear on this podcast? Oh, I'm just gonna say
Oh, I do.
crap
You'll be
in.
fine.
Okay, crap in, crap out. Okay, like if we're putting in studies that are on average not of a super high quality, the outcome's not going to come out in the meta-analysis. And this is where, because they've been really general with their selection of duration, in their selection of the types of exercises, like the components that you mentioned you listed, I think, 6 different types of exercises. Like that's very, very broad. And then if we look at the intensity and volume that they use, if we're not really selecting for those types of things, then we're not going to get like a consistent outcome. So if we look across the studies, in terms of how they've, like what exercises they've implemented, and then how they've progressed them, and then the duration and the outcomes of the studies. The first study that they've included is the Baltich et al. 2016 paper. It's got actually probably, I was really pleasantly surprised looking through this paper because I hadn't seen it before. They've got forward lunges, they've got squats, they've got hops in place and around the box, they've got some single leg balance and a lateral bound. Like they've actually got good plyometrics and some like actual knee strengthening exercises, and they've got hops. Like I was so happy to see this. I was generally grinning, and I messaged you about it a couple of days ago. I was like, oh, I'm pleasantly surprised about this. But they also actually go through a progression scheme where it gets harder, bearing in mind that some of these in this functional strength training group literally are just going onto a BOSU ball. So I'm like, oh, is that really like helpful? Is that going to increase the load through their tissues, or is that just going to make it hard to balance? Probably just hard to balance. So not the best progression, but they definitely actually chase like a single leg squat. They chase like lateral bounds and lateral hops, and then they increase the intensity of the distances that you're doing for those. So they are pushing up the intensity in a good way, but it's probably just going back to like, was everyone ready to start this program where it started? If they're novice runners, probably not. And then if we talk about the progressions, we don't know when is a suitable time for them to progress because it depends how they respond. And everyone just progressed every 2 weeks in this program. So that's just how it is. I would say in terms of the actual selection, nice. I'd like to see a calf raise exercise and a foot exercise, but otherwise it's good. The other group that they had was a resistance training exercise. And this is a huge flag for the rest of the paper, because resistance training to this paper was using some TheraBands to do some resisted inversion, eversion, dorsiflexion, and plantar flexion. Sorry, I'm going to swear again. How the fuck is that going to do anything for anyone? Right? Like, I'm sorry, like that. I agree we need to strengthen those areas, but a TheraBand is probably not the best way to do it. And there's no way there's enough resistance in that, even though they went all the way up to a black TheraBand, for that to be enough to resist your plantar flexion. Like you've got to hold the band. Like you can't hold the weight in your hand that your calf can do, if I'm honest. Like
Yeah,
that's my
and because I
opinion.
think no, that's true. Like I TheraBand early phase rehab, great.
Mhm.
When it's injected into like I don't it's early stage rehab. That's where TheraBands can be beneficial. Outside of that, because I think even at like the maximum stretch of a
Mhm.
TheraBand, the black one, I'm pretty sure it's like 9 kilos. I'm just going off memory, so do not quote me on this. Someone will fact check me, but I'm
Yeah.
pretty sure it's about 9 kilos of maximum resistance. And that's only when it's fully stretched. So say you're doing a plantar flexion exercise and you're resisting, initially it starts at 0 and it only incrementally increases. So it's only at the max stretch, max range of movement that you've got that 9 kilos. Slightly less, it's probably 8, 7, 6, 5, 4. So it does SFA, I feel. So
Yeah,
continue.
no, it's terrible. And they also used the isometric in this where they were just pushing into a wall, which maybe you can push a little bit more because like it's your body weight for the inversion and eversion. But they said they did dorsiflexion and plantar flexion, and they didn't really demonstrate how they did it. But I can't see how pushing against a wall with your toes is, and it's just your body weight and your balance resisting you against the wall, is going to give you enough resistance to challenge the plantar flexors at all. Like we need more than your body weight to do that, and we need it to not be limited by balance and weird setups. So yeah, I was not impressed at all by the strength training in this paper. And I know it's difficult to implement strength training in runners and make a sample that's like consistent across and relates to other research. But yeah, that's not resistance training. That's like early rehab, like you said.
Yep.
Yeah. So that was the first paper, and they found nothing, and they had a huge dropout rate. And they had really low compliance. Only 50% of the patients actually did the 4 times a week, and then a further 35 did 2 to 3 times per week. So, like again, call out for the what's going to happen in the strength training throughout this paper, and then call out for the compliance and the dropout rates for what was already quite a small sample size. That's the first paper that they reviewed. It's fine. It's a fine paper. I don't think it answers heaps of questions on its own, and I think it's pretty limited overall. Do you have any more comments on that one, or should I go to the next?
No, I just agree. It falls quite short. And like with the this is sort of sidetracking, not specifically to that paper, but I would drop out of that as well because people are time poor and we do something if we can see a perceived benefit. That's why it's important to sort of link our therapeutic goals to the client's goals and all of that. But if they're doing all of this circus crap and wrestling a wall with their foot and everything, and they're not getting or feeling like they're getting a benefit out of it, it's boring. Why are they going to do it? Like I would stop doing it. So it's
Yeah.
highlights that we kind of need to be mindful of factors that also influence engagement. And again, selecting exercises that are going to have at least some semblance of specificity to the individual.
Or going to be a tiny bit challenging. So, oh, this is hard. It's making me better. Or they can see they get better at not just pushing against a wall or a band.
Yes.
I guess you go a heavier band, but yeah. With the paper following this, yeah, I think it's Bredeweg, 2012 paper. This had a good sample size and way less dropouts, only 15 to 20%, and better compliance. And it was essentially just like a preconditioning routine for novice runners to prevent injuries in that population compared to just a stretching control. But what they essentially did, and this is where like when we're talking about dosage that you start at and how you progress, it needs to be a little bit better structured, particularly around certain types of exercise. Their pre-con exercise was 5 weeks of walking and hopping, right, for 3 times a week. And the selection of the starting hopping to me is like outrageous. So on the first week, they did a 5-minute walk followed by 50 hops in place on 2 legs 5 times. So they did 250 double leg hops on the very first training session, right? And I
Take
understand they
that,
just
Achilles.
matched. I know they just matched this, and I think like hops are awesome. I was so happy when I saw them in the other paper. This dosage is ridiculous for a plyometric, even if it's extensive and low intensity. Like doing 250 plyos is it's either not intense enough that it's going to get you the adaptations that you want, right?
or it's just way too much for the calf and Achilles complex. So I'm like not really happy with this. And they found that in this population, they actually more of them got hurt early on in training in this group compared to later on. So it's basically like if you can't tolerate this, you're going to get hurt earlier on, and then the rest of you will tolerate it fine, and then you'll be okay later on. Like that's how I view this study. I'm reducing it really simplistically because they essentially went from 250 hops on week 1 in the first training session to 9 times 60. Oh, sorry, 6 times 90 hops. So 540 hops, even more. Like I just said, 250 is too much.
100% increase.
They literally doubled it in like 4 weeks, which is like not the rule of 10%. And it's also just a lot of low intensity plyos that are like probably not doing anything to make your hip stronger and probably just kind of cooking you. And that's why more of them are getting hurt earlier on in the training and less are getting hurt later on.
Well, I think that also just speaks to that, the natural selection that we were talking to earlier, as far as the increase of running risk in novice runners. A lot of people will get injured very early in a training piece when they're new to running. So I think this, like how I'm interpreting it, is it's probably just weeding out those people that were likely going to get injured early on in running anyway. Because
I think that's definitely, but I also think it's just seeing who can tolerate the exercises. Like you've given them quite a specific, difficult exercise selection, and it's just like whoever can tolerate it might get a benefit. Whoever can't tolerate it is just going to get hurt immediately. So it's, yeah, or not immediately, like much sooner. So I think it's like, can you tolerate the exercise? And also like, are you just naturally the person who's not going to get hurt?
So is it creating some bias once they head into further intervention?
Yeah, I definitely think so. And this is not a comprehensive strength and conditioning program. This is just a little bit of plyometrics that don't really, to me, wouldn't achieve heaps. Yes, the walking and the hopping are a good start to prepare you for more running. You need some exposure to, repeated activities. You need some miles in your legs. But yeah, that dosage to me it just doesn't make heaps of sense. Even when I was reading through why they selected it, I was like, oh, I just don't know if I'd ever give this to a runner. Yeah. So again, huge problem with where they start, the selection of the exercises, and where they end up in that paper to me. And again, they didn't find anything in incident or rate of running related injuries. Should we go on to the next paper?
Yep.
Sweet. The next one is by Edouard et al. 2021. And again, they didn't find anything in terms of timing, rate of injury, or incidence of running related injury. And they really only had a quite small sample of road runners or middle distance runners or endurance runners, because they were from a selection of kind of like athletics camp participants or club participants. And from that sample collectively, they only actually had a compliance rate of 8% who did the program more than 2 times per week. That's really not going to be enough to anything to show up like out of the wash, when people are doing it that little and there's such a small sample of a relevant population for us, it's going to be hard for us to get much out of this paper automatically. In saying that, they actually had, I think, calf raises. They just called it going into the void for your lower leg. That's what they labeled the exercise. So I assume that was a calf raise, which is nice. They had some core, some balance exercises, and then some hamstring exercises. Because they were mostly focused on, I believe, sprinting and jumping athletes who are going to get more out of hamstring, pelvis, and core control exercises than a traditional runner will. But they had calf raises, so that's a win for this study, despite some of the other flaws that make it hard to apply to this population.
Yep.
I'm just going to go straight past that one. Okay. The next one, I'm going to butcher this name so bad, so I'm sorry, everybody. Halvarsen and von Rosen, 2019. They did a specific intervention to see if it would reduce the rate of injuries. And this is a very common theme. They had no significant findings unless the participants did it greater than 2 times per week. And in that case, it actually massively reduced the odds of injury by 75%. So really, really impactful when patients did it more often.
Yep.
In saying that, this was adult elite orienteers, which is basically trail running. And it was quite a small sample. the interventions that they used included some balance, some specific position exercises, some one-legged heel raises, and some side hopping. So very actually good exercise selection for orienteers. They're going to have, and trail runners, they're going to have a lot more ankle sprains, and they're dealing with unique like environments where their foot is landing in different positions. Having balance and neuromuscular control in this situation is really helpful. So they saw that there was a reduced rate of ankle sprains in patients who were compliant to this exercise program. And then they also just had a reduction in general injuries in this paper, which was really, really cool to see, because I think this was quite a good intervention selection. I am not super happy with the sample size, and it was a relatively short intervention time, but I actually think this was a really, really good protocol. And it kind of wore out in the wash that when they did it, it did reduce the risk of relevant injuries to this population. So we can't apply everything perfectly from this to our endurance runners that are running on roads, but it's a good start.
Yeah, and I think it really speaks to, like we've mentioned a few times throughout this chat, that selecting an intervention that's going to be specific for the demands of someone. So it's actually matching what the desired capacity is with the intervention to try and address that capacity. So modern life, we're walking around on lots of times flat floors, even surfaces. So just through our day-to-day activity exposure, we're maybe not being exposed to those perturbations in running surface and the changes of direction. So then this intervention, if it does expose us to that, it can help with that sort of lateral stability, the neuromuscular coordination for adapting to those uneven surfaces. So I think, yeah, aside from it being a well-constructed and thought out study as far as the intervention matching what the desired capacity is, it just, like you said, even though we can't necessarily, it makes it difficult to apply to general road endurance runners, getting us thinking that maybe if we are a little bit more specific with the desired or required demands of the tissue, matching that to our dosage. I feel that's probably the biggest takeaway. If we can't apply it to someone, at least the message of that can be applied, if that makes sense.
I think so. And they also just included like singular calf raises and hops. Like to me, that's enough to win me over with my biases. And I think that's all you need. I know you had me at hop and calf raise. Like those are probably the two biggest takeaways from any study is like, just do some calf raises and some hops, please. Please, dear God, please. That's where I land on that one. And I think, yeah, probably something that I do want to call out is if this paper is going to make people run less because people aren't reading the paper, then that's really frustrating because this paper basically tells us if people are more consistent, they're more likely to get a better outcome in terms of reducing injury risk. So the people who are just giving this paper are going to read it and go like, oh, strength training doesn't work, and they're not going to do it. And it's just, if you do these simple things more often, you probably will get less injured from the small selection of studies that we have that showed a benefit. So I'm kind of a little bit heartbroken by this paper as well. And that's why I'm being quite emotive and expressing the things and it's bringing out a bit of my bias.
That's good. You acknowledge the bias. We all have our bias. And then I'll dumpster fire my thoughts on it when we get to the end. So I'll let you keep punching through.
Yeah, sweet. The next study is by Lundstrom et al. In 2019. And they basically found there was a non-significant reduction in missed days and missed days due to injury. And this, again, was actually like an okay to good study design. I will say that when they pulled the core and plyometric groups for the actual WOO meta-analysis, because there was three arms, there was the control, the core, and the plyometric group. When they pulled the core and plyometric together in the meta-analysis, they actually found it was statistically significantly better compared to the controls, which was awesome to see. And this did have a small sample, but it didn't have any dropouts. And I think the actual intervention was good for S&C. So once per week for 12 weeks, participants who were marathon runners and training for a marathon at the moment would basically just do a few flying sprints, a few intense sprints, and then some change of direction exercises, some different plyometrics, hops, counter movement jumps, forwards hops, side jumps, and then some vertical jumps as well. And like this is quite a comprehensive plyometric program, and I think it's really aggressive. But they actually found there was no increase in markers of muscle damage, no increase in injuries, and no increase in soreness, despite using probably the most aggressive strength training or plyometric exercise program I've seen in the research recently in marathon runners. So people who are not well equipped to tolerate this tolerated it fine. And I was super impressed at this. And it kind of like undid a bit of my biases about strength and speed training in marathon runners. And I think if we, again, harken back to the fact that this did have a small sample size, so it didn't have the power to determine if it was statistically significant, but it did trend strongly towards being effective. If we have a bigger sample for this same study, I'm not saying it would, but there's a good chance that it might, at least what we're in the wash, that this is a significantly effective treatment. And I'd love to see that, because the days missed were like a third as much in this group compared to the other groups.
And just a question on that, with the intervention group, was their weekly mileage comparable or the same as
It was
the
the
control
same.
group? So they didn't drop a session to introduce a session, it was added on top?
Yeah, I believe so. They kept the groups were similar throughout. I can pull up the paper and just confirm that for you now. And that's why I think, yeah, they had a training log that was tracked, and let's just see their training
But
log.
whilst you're looking for that, so essentially my question is basically if they were adding that intervention on top of, so say everyone was, I know this isn't, it's just for my math brain, so let's say everyone was running 50 Ks a week, and then
I can actually tell you
the
the exact
intervention
numbers.
Yeah, how much were they
I've got-
running a week?
So the plyometric group ran more. The core group did 16 Ks, the plyometric did 17.3 Ks, and the control group did 16. And that was during their just like pre-marathon training. And during the marathon training, the core group did 26, the plyometric group did 28, and the control did 27. So yeah, they actually still tolerated like more training and had similar rates of injuries and less days missed, which is insane.
Yeah. See, that is interesting, because I would have thought if they added that in on top and they were doing more, then there would potential. So that shifts my thought a little bit on that. So it's.
I would have thought this cooked them. I would have thought this cooked them looking at it. I was like, holy shit. And then I read the paper and I was like, oh, this actually worked. And they tracked all these things that make us think that it wouldn't. And they all panned out. Like, yeah, I think the sample is too small for us to make really strong conclusions.
Yeah.
But a cool paper. Very cool paper. Yeah, and this is something we discuss as well. Like, we think that it's probably not a bad thing if sometimes this training takes away some of your running training, because you'll still get more effective, more efficient, better performance doing some strength training. And you have a bit less mileage, so you've got some space to, not overtrain. But in this case, they did both, and it still worked out okay, if not trending towards being effective. Insane.
So now that you've got the paper up there, so two more questions. One, were they reporting on the running pace that they were doing, or was it just weekly mileage?
I believe it was, they took all the data. They had a training log, but they've only reported on the readiness to run, the distance, and then...
Did they do time?
That's such a good point, because they need the 100 hours. They didn't report incidents in that same way, though. No, they just reported RPE and then Ks.
Because my question would be, and so Nitter speaks about this quite a lot with the polarized training. So 80% really easy, 20% really difficult. So I'm curious as to whether the intervention group, if they were doing their easy accumulation of Ks at a much slower pace and then doing their intervention running at a much faster pace. So if their overall cumulative load was at a slower pace and then the intervention was just a bit higher, I don't know if that makes sense. So
no, it does. They're a bit more fatigued. They can't run as fast, or they're just putting their speed into their
Well, it's not
intervention?
just the bit more fatigued and then they can run fast for the intervention. It's like when we actually look at running speeds affecting musculotendinous loading. So there was a paper that I was looking at last year in the monthly subscription, like the Gait Footwear and Movement subscription that I've got on the P3 platform. We were looking at how running speeds affected Achilles tendon loads, and that was looking at, I think it was maybe 11 or 12 Ks an hour, 14 Ks an hour, 17 Ks an hour, and the cumulative loading within the tendons itself, it significantly increased the faster that someone was running at. So if someone's doing more Ks at a slower pace, that's going to be accumulating less sort of tissue stress as opposed to doing that same mileage at that slightly faster pace. So I am interested if the intervention group, if their overall pace was slower and then just the speed training was quicker, because yes, that's something that doesn't sound like it was reported, but that would be my
No,
question.
no. But I love that paper you just mentioned as well, the per step load and accumulative load at the Achilles, knee, and tibia. That's a great paper. That's a good paper. I
Oh,
think that's something you're referencing.
that was one paper I spoke about, but the one I was referring to was a little bit, I'll have to look that up.
That's all right.
Yeah, so there's two papers. So that one was a recent one. And then I think the one that I actually was mentioning from last year's lit breakdown is a few years older. Why you keep talking? I'll look it up.
So yeah, I actually think that's a really cool study. The next study I think is also really, really cool. I just think that we don't get as much out of it as we could, because it's essentially in female track and field athletes who are quite young. I think the average age was 15 and they were like 11 to 18 years old. But they did a really awesome specific treatment for these runners, and it massively reduced the injury rates, particularly in medial tibial stress syndrome. And I think the interventions that they did really speak to why that is. And given that this is a tiny sample of young females and they're track athletes, and only a few of them were actually middle and long distance that were taken and collected for the meta-analyses, I still think that the high compliance and the no dropouts and the intervention itself really lend power to this study, like make us appreciate this study a lot more, because they had 6 weeks of intervention, which is a bit short, but they did it for 3 times a week, and they had loaded calf raises at the end. It started as body weight. Then they went to they had hopping, they had knee and hip dominant jumps in terms of squat jumps, bounds, single leg hops, and jumps over hurdles. And then they also had hip thrusts and side bridges. This is like the perfect dream kind of physio intervention, or S&C intervention for a runner. And it's like, I was looking at it frothing, like this is such a
I love a
nice
hip
paper.
thrust.
I love a hip thrust. I love a side bridge for a runner. Like hip abductor strength is so important. They had some quad exercises in lunges and our jumps. They had some hopping, and they had some calf raises that was loaded with dumbbells in like 15-year-old girls. It was so cool to see. This is such a nice paper. It's like such a big dichotomy compared to some of these other papers we've just looked at. So they
You can
massively
do more than body weight. Oh my God.
Oh my God, this 15-year-old girl can do 10 kilos on a single leg calf raise. So good. We love it. So they basically had a massive reduction in injury rate, particularly in the medial tibial stress syndrome, because they included hard strength training and they included plyometrics. Those things are really good at improving the strength of your bones in a really short period, particularly in younger females who hopefully are having, no hormonal disruption. That is going to be awesome at improving bone strength. And if we just improve the bone strength, it's probably going to reduce the risk, particularly if the bone gets thicker in the tibia. So I think, yeah, really awesome paper. Unfortunately, I think there was only about 9 or 10 participants taken from this.
Yeah.
It might have been 13. I'll have to look, but very small sample taken from this for the actual meta-analysis, and that's okay. But I'd love to see this study almost exactly replicated in runners, because I think in long distance runners with more people, because I think it would go really well. And this is like exactly what I think the paper should look like.
Yeah. And it is interesting when we're talking about MTSS and stress injuries of the tibia, excuse me, because this is one instance where like hypertrophy training is alluded to being somewhat protective of this, because I can't remember the name of the paper off the top of my head, but paper from quite a few years ago, they consider that the size of the calf muscles actually attenuate some of the bending moments that occur in the tibia during weight bearing. So with these athletes, so yes, you've got that plyometric load, which increases bone density in females. There's been studies on that. And then also the size of the calf muscle actually reducing some of those bending loads. So I have to look these studies up again. I can't Rain Man this, but yeah, there is evidence for that. So that kind of weighs in. And
so wait, I'm just gonna add something, because
yeah,
I feel like it's important. Probably not going to be hypertrophy mediated in this study because they're really young and kids don't get as much hypertrophy. And then also because it's such a short duration, it's less likely, but the strength of the muscle relates strongly to the strength of the bone, and the health of the muscle as well, like really strongly relates to the health of the bone. And I think, yeah, just having like even slightly better tendons pulling on the bones strongly relates to improving the quality. But there is a really good paper on the size of the calf muscle predicting, again, the strength of the bone. And I think Rich Willie posted on it recently. I've read the paper, but I haven't. But yeah, if you just go look at Montana Running Lab, there's like a graph showing the main findings from this paper.
Oh, okay. I love Rich's posts.
Yeah, Rich is best.
So just mentioning that Achilles paper. So the one that I was referring to it's from Starbuck et al. 2021, the effective speed on Achilles tendon forces and patellofemoral joint stresses in high-performing endurance runners. So that's the one that we were looking at, the speed in the Achilles affecting essentially the loads. And it was about 12 Ks an hour, 14 Ks, 17.28 kilometers an hour, and 20 Ks an hour, which is, I can maintain that for all of 15 seconds. But yeah, it wasn't a massive increase in the patellofemoral joint loads, but in the Achilles tendon loads, there was.
Interesting. Yeah. I would have thought, just from like the Dawn research that we have, and I can't remember the bloke who did the other muscle force studies. I wouldn't think that Achilles would increase massively just because I'm going to get so derailed by this. Just because the calf is not going to increase in muscle force heaps as you increase the speed. I would have thought, and I think the more recent paper found that the patellofemoral forces increased when you increase the pace, but the Achilles and tibia didn't massively. Not significantly, at least. I might be misremembering that though.
Because like the function of the Achilles tendon is to store and release the mechanical strain energy.
Oh, so it's just storing more. Oh.
Well, yeah, if we're running further and faster, so then relative, like once you factor in velocity, ground contact time, everything like that, there's more load within that it's storing and releasing. So to me, it makes sense. And then it's also reflected in, like, when we're doing return to run programs, everything like that, we always build volume before we build intensity because of how it affects the tissue loading.
Yeah, you can't tolerate speed very long. Like you said, you can only hold the 15 Ks or the 17 Ks for 15 seconds, but you can definitely tolerate 12 Ks for a long time. That's just in terms of perceived, but also in terms of tolerance of tissues. It actually marries out pretty well.
Yeah, and you see it with the reactive tendinopathy. So if someone, like especially with novice runners, every run they sort of want to run at hard, but you can only do that for so long before your Achilles tendon hates you. Whereas if you sort of halve the pace, you can run 3 times as far because you're not accumulating as much stress within the tissues.
Yeah, definitely. I think let's just jump to the last 3 studies, because I think these are 3 really good ones as well, just for emphasizing a few points, or 2 of them are rather. The first one I'm going to mention is the Taddei et al. Foot core strengthening program, which is like such a cool concept. Like literally just strengthen the medial and longitudinal arches, the medial, longitudinal, and transverse arches of your feet, and it'll just be able to increase the resiliency and absorption capacity of the ankle and foot. And that seemed to reduce hip and knee and low back injuries in this group, and it was like quite a large sample. And it was like probably the largest sample that showed a really good effect, and all they did was just 14 random kind of foot exercises, if I'm honest. Like to me, I think it was a lot of interventions to use to get the outcome. There was a fair bit of like foam rolling, massage, and stretching involved. And then there was just a few calf raises and then big toe and toe curl based exercises. And it really, really worked to reduce running related injuries in this population. So I was pretty happily surprised by that. And I think it's just a good call out that foot and calf exercises should be included in most of our treatments. What do you reckon about that?
Well, Luke Kelly, he's it's quite funny. When I think back to uni, I remember having a bit of a debate with a lecturer where their opinion was the intrinsics don't matter because the extrinsic muscles of the feet, they actually have bigger moment arms and they produce more force than the intrinsic muscles. But if we've got them, they're there for a reason. And then more recent work with Luke Kelly, and I know there's probably other authors out there, but I'm just thinking of a couple of Luke Kelly's papers off the top of my head, that when we look at the role of the intrinsic muscles, how much energy they actually store and release, and they contribute to the sort of energy production or energy recycling through a gait stride, it's actually the intrinsic muscles of the feet actually do contribute quite significantly.
Yeah, you have to have a stiff foot so that you can, or at least, absorb the force well in the foot so that you can transfer it to the Achilles, right?
Yep.
Yeah.
So intrinsics, bash on to what are the last two? Because I know we've taken a while through this, but lots of insights.
That's totally fine. This was so much fun. The last two papers, one of them was literally just some stretching and some running exercises and like some dynamic stretching. So I'm not even going to touch on that. It's like a 30-year-old paper. It's not really super high quality, and they found no effect even though it was a good sample size. And there was pretty poor adherence even to that. But overall, that's just a good reflection of some of the qualities of these papers. And then I think the last paper by Torres-Dal et al. In 2020 is probably the best pinnacle of what they did. And it just goes straight back to that. Where do we start? What's the actual intervention and how do they progress it? Because they basically started just doing some like body weight squats, just doing some this and that, and then went straight away to doing heaps of plyometric exercises, like a gross amount of plyometric exercises. So yeah, like really, really not what we're looking for in terms of dosage. Initially, just doing 20 squats is not really good enough, and then going and doing heaps and heaps of plyometrics is just, it's almost never gonna work out very well for our populations. I'll just tell you the exact specifics. They did 20 regular squats, 10 lunges, that's okay. Some toe touches, some side planks, and then some more regular squats. And that went straight away from 20 squats and just replace that for 20 plyometric drum squats. And plyometric lunges were just swapped 1 for 1. That's such a silly progression to me. Why? How can you go from doing 100 bodyweight squats to 100 plyometrics? And they even did plyometric single leg toe touches. Like, I just don't understand at all why this was considered a good intervention or dosage.
Yeah. No.
This group actually got more hurt than the group that didn't do it.
Are we surprised? Holy crap.
I'm just baffled by some of these interventions, the progressions. I think the adherence was pretty poor in this as well. And I can see why, but yeah, it's just
the level of exploding.
Honestly, yeah, the level of evidence here really needs to step up. And I think we've got a few key papers in there that are really good and I was really happy with, and I want to see them replicated. And we just need to see them actually be adhered to. We're not asking if patients can adhere or our runners can adhere to a strength program. That's not our question. We need to set up a study where there is supervision, where adherence is strongly promoted and encouraged and enabled, and then that they choose good interventions that are done long enough or intensely enough. Because I think from this paper we can see that you don't, and from every kind of like strength and conditioning research, you don't actually need to do the studies for heaps long. It's better if you do, you'll get a little bit more out of it. But you only really need like 6 to 8 weeks to see some adaptations and reduction in risk. And you just need it to be intense. You don't even have to do it 4 times a week. You can do it probably 1 or 2 times. It just needs to be intense. And if it's intense enough for long enough and people do it enough, we're more likely to see some good outcomes, especially if they just include some hops and calf raises and some squats and some jumps. Please just include those things. If there's a researcher listening, please. I know it's
Or
so
give us
hard,
money so
but
we
you're
can do
doing
it.
so well. Oh, please don't. I couldn't be bothered to do this. This is such a hassle. It's hard enough getting my patients to do it.
Oh, yeah. Wait till you become cynical. Add another 10 years to practice, and then you'll be like, oh, maybe I'll see patients less and I'll do research more. But that's just projecting my experience on everyone else. So I think overall, like, I really do appreciate you giving your time to help me break this down a lot more in depth, because, and I think the sort of key takeaway, or key takeaways, there's probably a few of them, is there is such a phenomenal heterogeneity between studies. So basically, there's so many studies that are constructed to look at kind of answering the same generic as hell question, but they're constructed differently. The exercise interventions are so different. And some of the exercise interventions are probably selecting exercises and their prescribed dosages that are insufficient to create positive adaptation. But then we've got others like these plyometric ones where they're just trying to blow the legs to pieces, where it's probably significantly overdosing someone. So I think it all dials back to probably the example of one of the papers that we were talking about earlier, as being a little bit more sort of specific with our selection of the exercises, considerate of the individual dosage requirements of the individual, and then just progressively loading based on a performance criteria or an adaptation criteria as opposed to a time criteria. What would you say would be your takeaways from that?
Yeah, I would definitely agree. And I think our takeaway should be that this wasn't a study on does strength training work. Like that's not what this question, like what this paper answered. That's not the question that it answered. It kind of actually just raised a few more questions, which is like, what is the exercises we should use? What's the intensity and volume that we should do them? How should they progress? And then how do we make runners like actually do it? And it seems like supervision is enough. So I don't think we get any really definitive answers from this. Again, I'm a little heartbroken that this might actually make people not do it. But I think going forward, some designs that we should look for, it should include some more specific exercises for endurance runners that are calf raises, hops, some squats, some squat jumps, or some single leg exercises, like some weighted lunges or some weighted calf raises. Just something in that vein would be really great to see. If they add some core, some balance, or some side bridges or glute exercises, awesome. But I really think the nuts and bolts should be those 4 exercises I listed at the start. And then I think we really just want to see them dose it in a way that makes sense. Like you said, using rate of perceived exertion or reps in reserve to just make sure that they're doing it at a way that's kind of consistently challenging, monitoring their distances and their pace if they can, or even just, making sure that they're not dropping off heaps, and that's why they've reduced. To be honest, though, rate does accommodate for that. If you're running the same amount or you're running less, you might just have less injuries per hour of running or per K. So that's a nice statistic that does help. And then I just want to see this done consistently by the runners. Like it needs to be supervised, it needs to be long enough, and it needs to be intense enough.
I do agree with that. And I just wanted to say again, I do appreciate your time with this, because I know there are some elements that we do disagree on, and having conversations that kind of challenge my bias, my beliefs, and I know
Vice versa,
you're feeling the
definitely.
same. It's so overall, would you say that, well, just in general, but as the results of this paper, has it influenced or reinforced your approach to strength training for runners in an injury risk reduction perspective, or does it just literally reinforce those points that you highlighted, that you want to see changes in the research and the application?
Definitely some of the papers make me question like how much we can do. Like we probably can do more of certain things. We probably shouldn't push too hard at certain times, and we should be a bit more gradual. Like it definitely changed some of my beliefs around that. But realistically, I think the foot intrinsic paper made me want to do more foot intrinsics. That's not something that I commonly prescribe as a physio. I should do that more for more specifics. But realistically, I'm never super certain about what I do. I'm never super strong in my beliefs. And I think this doesn't wax or wane me heaps. Looking into the data, I can see why it wouldn't work, why it would work. And I think given that I do treat mostly injured runners, it makes sense to just keep doing these because it probably helps more in the injured population anyway. So sorry to cop out entirely of that. I'm going to I'll circle back and say I'm definitely going to keep doing strength training for my runners because of all the things that I've listed. And I'm going to do all the things that I can based off the holes in these studies to make sure that exercise is the most likely to be effective. If it comes out in 5 years that none of the things I'm doing are effective, I'll go, oh shit, well, my bad. And then I'll change what I do. But at the moment, I just don't think this cancels out anything.
Yes. And I think highlighting your point, we're looking at this from the lens of health practitioners. The vast majority of the time, we are treating people that have a problem. So the clinical utility of us utilizing strength training to prevent future or reduce the risk of developing another running-related injury, that's probably where we fit into this. So maybe some of this isn't really entirely applicable because it's unless you're someone like Nitta who does a lot of running coaching, then oftentimes us as clinicians aren't going to get someone who is uninjured and just beginning to start their running journey, so to speak. So where I would probably sit is in the rare instance that I've got a new runner, then I would probably inject a little bit of strength training for that load variability and capacity building. But then as far as the application of it, I think it just gives some insights into how we can manage running injuries with strength training to help build capacity to return to running, and then being specific with the interventions. When I talk about interventions, the exercises and the dosages we're selecting to make them more robust when they're returning to running to reduce the risk of re-injury, not so much acquiring a new injury, if that makes sense.
Yeah. The reducing recurrences is a completely different mechanism. Like you just mentioned, they're going to have reduced capacity because they haven't run. So you just have to prepare them for running. And if they have like really reduced capacity at the site to reduce recurrences of that injury, like we actually just have to make it a lot better as well as we can. So yeah, totally different ballgame. Please keep doing strength training in your injured runners. Oh my God. If this paper stops people doing that, I'm going to be so upset. So yeah,
Rage
different
quit
ballpark.
life.
Yeah, rage quit life. Just before we finish off, because I'm going to go in a few minutes, I just wanted to say some other things that are fancy that we can do to make sure we don't get injured is definitely do better S&Cs. Like just do a better job at doing strength conditioning. It's going to maybe help for injuries, but it'll definitely help for performance. And then consider some small changes in technique for some key areas like cadence, lateral hip drop, and then maybe some other key factors. And then maybe rotate your shoes. That might be effective. That's the flashy stuff. The real cool, awesome stuff that you should do though is like manage your load better. Make sure you've got some structure. Make sure you're not going completely crazy and running heaps. And then make sure you recover well, eat well, and don't let niggles get away from you. Just listen to your body.
I think that's a really great summary of everything. I think we're going to have to do another episode to unpack a few of those. But in the meantime, if people are interested in learning more about all of that, we do have the monthly subscription Gait Footwear movement from the Progressive Podiatry Project, progressivepodiatryproject.com/GFM, because we do unpack a metric shit ton, basically, of a lot of evidence pertaining to a number of those factors. But if you're keen, I know it can become a bit of a time vacuum with the vortex as we fall down. If you're keen, I would love to have you back to discuss a few more of those flashier elements to kind of expand on this talk where we've spent a lot of time unpacking a lot of the nuance that exists in the running injury space, but essentially coming to the conclusion that the study doesn't provide a significant influence on what we're actually doing day to day.
Yeah. And I think we did a good job. Like, I definitely tried not to buy into the small studies that showed that it worked. I definitely tried not to buy into the big studies that didn't show that it didn't work because they didn't necessarily structure themselves the best. I think we were pretty good at carrying out the nuance. So hopefully people enjoyed that. I think we did a good job.
Well, if they didn't, I did. So it's okay. So thank you, Beau. I really appreciate your time. And it was worth getting out of bed early as hell this morning to have a chat to you. So I look forward to the next one.
Yeah, easy. We'll do some Gait stuff, but we've got to do bone stress next. Yeah?
Yes, definitely. Bone stress. That is coming.
All right. Easy. I'll catch you later.
Thanks, guys. Bye.